So good morning, my name is Francesco Bandello, and I'd like now to say you what I was presenting about the long-term follow-up of patients with diabetic macular edema treated with anti-VEGF. So this is a very important topic because, as you know very well, the prognosis of diabetic macular edema in patients treated with anti-VEGF improved a lot. And we can say that the advent of anti-VEGF therapy was a real revolution for us as doctors, but mainly for our patients. Unfortunately, with reference to this specific use of anti-VEGF, we must say that we have still 40 and maybe more than 40% of our patients that are not sensitive to the use of anti-VEGF. So one of the main points is first to be able to identify a priori who is the patient that will have a good response, and to distinguish these kind of patients from the others, the 40% that do not respond. And this is the first point. The second point is that if you look at visual function after a long follow-up, which means 5 years, more than 5 years, you discover that many of our patients do not have the same visual function that they showed after 1 year of therapy. So the aim of this topic, the aim of this presentation was to try to identify which are the clinical patterns of patients that show good response and patients that show bad response to anti-VEGF. And what we found is that using OCT, structural OCT, it's possible to identify the significant parameters that are able to identify bad patients and good patients. So I'm going now to present you the main results of this study. The first one is that external limiting membrane, ellipsoid zone, and retinal pigment epithelium are the three parameters that you must consider in the OCT in order to know if that patient will improve or not using anti-VEGF. Whenever you have that these parameters are altered before starting your treatment, that's a bad patient. And the other point is DRIL, the disruption of internal limiting membrane layers. This also is important to be considered. Whenever you have this DRIL, the results in the long term will be bad. So look at the OCT pictures of your patients, and you will be able to identify who will be able to improve from the others that will not improve. So that's the main results of our study. Thank you very much for your attention.